So a really common question I get is, how do I use a TENS unit? And I think a TENS unit is one of the best, most underutilized tools that we can use. It's great for nerve pain. It's great for muscular pain. It helps increase blood flow to the area. It helps confuse any kind of nerve damage and help relieve that pain. And I use my TENS unit a couple times a week. So I'm going to show you how to use it. Okay. So just for demonstration purposes, I'm just going to put this on my forearm here. I get some lateral epicondylitis every once in a while. So I think this is a great chance to show you how to use it. So first thing you're going to do, there's two plugs on top, and it doesn't matter which one you choose. You just plug right on top. So here's a plug, here's a plug. I just plug it in right there. Okay. Next thing is, get your patches in place before you turn it on. If you turn it on and you grab the patches, you'll shock the crap out of yourself. So I've done that more than once in my day. Unfortunately, did it to my daughter about 3 weeks ago. She's not very happy with me. So make sure you put it on before you turn it on. Okay, so you span it across the area. This is my tendonitis. I'm going to put it here, and then I'm going to put it right there. Okay. Now we're going to turn it on. I'm going to show you how this works. Okay. So come on in. Make sure that you can see this dial. Okay. So I'm going to turn on this dial, and then you're going to pop it open. And now, right now, you can see it's on burst. So watch this little thing here. You got burst, you got normal, which is a constant stimulation. You got modulation, which kind of makes it go up and down. You got SD1, which is another varying program, and SD2. So burst, it kind of ramps up and comes down, ramps up and comes down. And normal is just constant. So you want to program it in normal, because that's how you're going to dial up your intensity, okay? So go ahead and let's focus on my forearm now. So I'm slowly dialing up the intensity here, okay? And you want to go until, see how its muscles moving now? That's about where you want to stop, okay? And right there it feels good, okay? Now watch what happens when I crank it up even higher. Okay, there it's kind of, that actually feels pretty good. But I'm going to turn it down, and then I'm going to show you what it looks like between the different modes here, okay? So I'm feeling a nice little stimulation across there. So just keep an eye on my forearm there if you would. And I'm just going to cycle through the different programs. See how that's one modulation mode. There's another one. There's a third one. And then let's go to burst. This is burst. See how it's just... Now, just play with that. And sometimes I'll be on one mode. I'll be like, you know what? I want to go to this different one. And it should always feel good, okay? When you get to the point where it starts kind of feeling tweaky and it's getting a little bit too intense, that's when you need to stop. So you can just unplug it and then shut it down, right? And just shut it down until it turns off. And again, make sure it's not on when you put it on and take it off. So I reuse my pads on a regular basis. A little warm soapy water, and you can get about 10-15 uses out of it. And it's a great adjunct or addition to treating your chronic injuries and your pain. These things cost $30 on Amazon, and I think everybody should have one. It's a great tool. Appreciate you listening, and look forward to teaching you some more stuff.